our meeting, and that I know adds some challenge to everything. As I said, I am Judy Brewing. I am the dietitian. I've been with hospice since its inception in Mercer County. So it's a long time. I can't even tell you when. But I've been with hospice a very long time. You probably maybe seen my name around, probably just not the face a whole lot. So, but anyhow, this is a face to the name. A little bit of background as far as that I'm concerned, which is going to kind of help you understand my perspective a little bit. I do work primarily at Mercer Health. When I'm at Mercer Health, I work primarily in their weight management center, but I also do home care, so I do home visits. I work on the patient floors occasionally. I obviously work hospice on the side. I work also hospice with Miami County on the side, so I see patients with their hospice as well. And once a week I work at the Grand Lake Regional Cancer Center on the radiation side, and that's located in Salina. So I have a lot of experience in terms of a lot of different patients. Now at this time I don't work in a nursing home, but I've also in the previous years I've worked nursing homes, I've worked assisted care, that kind of thing. Been a dietitian for over 35 years. Mostly in this area, like as far as like Mercer, Van Wert, Autley, Stark counties, kind of in that area is kind of primarily where I've been. I'm also a cancer survivor, and I'll get to that here in just a little while. Okay. So just to kind of give you my background so you can understand my perspective. I've asked to come to talk to you today, and obviously we're going to be talking about supplements. Okay, that's why in front of you you see samples. The discussion started several months ago as far as the supplements that you're using here, and I understand that to be mostly, let's say, the Ensure products and that kind of thing. And so we were having a discussion about the quantity that you're using and some of the appropriateness and that kind of thing. Well, I'm not going to get into a lot of that, but I want to cause you to think about maybe supplements differently. Okay? Recording me, so you have to pay attention to where I'm standing. When I work in the radiation oncology department, okay, a patient comes in, they have cancer, and obviously we are working, and I use the word cure loosely, but we're working curatively. We're giving them radiation, sometimes they're getting chemo and radiation together, and I am their biggest cheerleader. I am doing everything I can to get them to eat that high-calorie, high-protein diet. I'm offering Boost and Ensure and Carnations and breakfast, and we are weighing them and we are supporting them. And at that point, we have a discussion where sometimes eating just isn't even fun, but we are eating for function. We really are eating for function, and they're working their tails off. Their families are supporting them, and so forth. So hopefully, we get them through that. But let's say then, unfortunately, several years later, they come back. Let's say that their cancer has reoccurred. Unfortunately. And let's say now that we have to treat them more palliatively. Maybe we're treating them with radiation, maybe to help control bone pain or something like that. Well, it's pretty obvious that their cancer, their disease is probably going to, will probably end up being terminal. But at the point then that they're with us and we're doing what I call palliative care, I am encouraging them there also to eat a healthy, balanced diet. And if that includes things like the Carnations and breakfast and the Ensure and that, that's fine. Sometimes the families will say, well, what should I have them eat? Okay, that's an easy question. What do they like? What do they enjoy? That's what you should be providing. Okay, so if their appetite's not great, give them what they like. Okay, the reason I told you I was a cancer survivor is because I went through chemo. Yeah, my appetite was horrible through chemo, and I lost weight and all that good stuff. And so sometimes it is hard to eat, but again, you remember that you have to eat for function. You have to eat because if you want to heal, this is what you got to do. And that is hard work. And the thing is what happens is when our patients go from curative to more to palliative, and then eventually, unfortunately, hospice, the family's still thinking over here curative. So the family's still thinking nutrition, jamming it in, giving it everything you can. Where when you're over here with hospice,